Hello, my name is Aparajita Bhandari, and I'm excited to present our work on multi-stakeholder perspectives for digital tools for U.S. asylum applicants seeking healthcare and legal information today. This work was led by the Cornell Social Media Lab and the Department of Communication, but was undertaken in collaboration with many other groups and centers at Cornell, outlined below. So the U.S. has the largest and most complex immigration system in the world. Several million people enter the U.S. each year in over 30 different visa categories. And one such category of immigrants are asylum seekers, which refers to someone who is in the U.S. who is seeking refugee status but has not yet received it. Asylum applicants and other immigrants face many challenges when transitioning to the host country, including health risks and the need for social services. However, long-established federal rules have sought to limit immigrants into the U.S. if they would become a public charge or require public assistance. Further changes in 2020 exacerbated this problem by threatening immigrants already in the U.S. who use public benefits. And although these changes have been halted and repealed, there has still been a chilling effect on immigrants, many of whom have disenrolled from benefits such as SNAP and healthcare systems. So part of the problem is that there's lack of clear and accurate information on the public benefits that are accessible for immigrant populations. And digital tools can be part of the solution to help provide this vital information to immigrants. Previous HCI research has examined the role of socio-technical systems in immigration contexts, and with focus on designing across language and literacy barriers and using tools to provide support. Privacy and surveillance has also been highlighted as a key consideration for immigrants. And more recently, there has been a move towards user-centered and community-based design frameworks using methods such as code design and speculative design workshops. So this specific project is guided by these two broad research questions. What information seeking challenges and needs do asylum applicants in the U.S. encounter when seeking information about public benefits through digital resources? And how can technology be used to bridge the gaps between U.S. asylum applicants' information-seeking needs and available resources? In order to answer these questions, we use a twofold qualitative method approach with face-to-face interviews conducted with asylum seekers, as well as online interviews with legal and healthcare professionals working with both asylum seekers as well as other immigrants across the U.S. So between March and May 2021, we conducted 24 semi-structured interviews with asylum seekers, and these interview participants were recruited to the Royal Cornell Center for Human Rights in New York City. And then from July to November 2021, we conducted 13 semi-structured interviews with healthcare and legal professionals across the U.S. using snowball sampling to recruit, and all of these interviews were conducted over Zoom. We found 4 major challenges to finding and using currently available informational sources. And we also found a series of design insights emerged and that were associated with each of these challenges, which I will highlight in the next part of the presentation. The first challenge that we observed was informational uncertainty. Interviews with both asylum seekers and professionals showed that there was a lack of trust in the informational sources as well as the accuracy of information that is circulated online. Information can be out of date and thus be inaccurate, or it can be purposefully deceitful. We also found that misinformation circulated within community groups as well. And so in order to address these informational uncertainty challenges, we recommend that designers of digital resources incorporate accuracy cues into their tools, such as indicators of when information has been updated, as well as we recommend transparency around informational sources. So one should link to primary sources when appropriate and make clear who and where the information has come from. And so these two quotes highlight this kind of tension within and challenge with informational uncertainty. So the quote on the left from an asylum seeker talks about a scam that the asylum seeker fell victim to, and then the right quote from a healthcare professional talks about the nuances in terms of what is considered trustworthy sources of information among different groups. The second challenge that we identified was emotional barriers, and these were mainly fear and stigma. There was a great deal of fear identified from both professionals and asylum seekers around government surveillance, as well as concerns around data privacy when using online and digital tools. which was exacerbated by over-collection of data in a lot of different types of resource settings. Additionally, stigma, which is something that is accessing benefits had a lot of stigma attached to it, and accessing benefits more generally can also have this stigma attached, but due to increasing narratives around immigrants coming and taking more resources, the stigma has been exacerbated amongst different immigrant groups. So we see here with these two quotes on the right, referring to kind of the stigma faced by this asylum seeker and the kind of the stigma that they feel, as well as the right quote talking about potential types of fears that people may have, this referring to undocumented immigrants, what they might have when trying to use digital resources. So in order to kind of address privacy-related fears, we encourage designers to recognize that fears are not unfounded. There is a lot of danger around using these tools for different immigrant groups and asylum seekers, and so we recommend the precautionary approach put forth by Yale-Loehr and Hendry, and kind of encourage the minimum amount of information be gathered. We also think that one potential other recommendation could be to try and integrate plausible deniability into a user interface. So instead of having options that say things like I'm undocumented when trying to prompt users, you could put a prompt such as I'm seeking information around undocumented groups in order to create a bit of distance and deniability within these different options in the tool. The third challenge that we identified was around accessibility, mainly around language and literacy barriers, as well as digital literacy. While many professionals were concerned with immigrants' levels of digital literacy and internet access, the asylum seekers that we interviewed actually highlighted that they used a variety of online and digital technologies, reinforcing that digital and online tools are a way to reach these groups. And so in order to kind of deal with these accessibility barriers, we recommend designing for parsimony. All tools should be clear, simple, and easy to navigate, as well as mobile user-friendly in terms of low connectivity settings. And so the final challenge that we encountered was around contextual sensitivity. It's important to remember that asylum seekers are not a monolith, and many different factors can play a role in shaping one's experiences. So in order to design, we encourage a contextually sensitive design approach and moving away from one-size-fits-all approaches in order to appropriately scope tools, and encourage kind of potentially working with community partners and local groups already doing this work in order to be sensitive to the specific context that you're working within. So kind of to conclude, we have a website highlighted here, rightsforhealth.cornell.edu, in which we actually created using these design principles in order to provide information about health and legal information to immigrant groups. And so this tool really put into practice a lot of the different principles that we talked about, and was shaped by our interviews with both asylum seekers as well as professionals. In conclusion, we'd like to acknowledge all of the different groups and that research assistants that we worked with in the law school, the Center for Human Rights, as well as the Cornell Social Media Lab. And we would also like to thank and acknowledge funding sources from the Migrations Global Grand Challenge Initiative, and as well as the Multi-Investigator Initiative in the Office of Academic Integration, both at Cornell University. Thank you.